So thanks everybody for joining this afternoon. This is just an effort we're making to keep people as informed as we can about the COVID experience, certainly at the university and in our faculty. I know you're all monitoring COVID, pretty extensively. Can we go back to the first slide? And I think you're all well aware that this is a worldwide pandemic, now involving almost 1.4 million deaths, 315,000 cases in Canada, 12,000 plus in our province, 11,000 deaths in the country, and approaching 200. Presently, and one of the key features of COVID in terms of the mitigation efforts is to try to keep the hospital and health structure in a position where it can cope and manage with the needs of patients in the community. So we presently have over 260 people in hospital, 43 in ICU. We have been designated a red zone by the province. We're carrying a test positivity rate of about 14%, which is very high. You'll know that anything above 5% really constitutes significant community spread. Schools and universities and colleges have remained open. The university case, it's not entirely, but nearly all virtual, and schools continue to meet for the most part in person. Next slide. We've had 53 cases across the University of Manitoba, 36 at Fort Garry, 16 at Bannatyne, and 1 at William Norrie on Selkirk. Of the 53, 28 are in the Rady faculty, so about half of the cases, and the difference being the number 12 in nursing. So we've had 2 in dentistry, 12 in medicine, 12 in nursing, and 2 in rehab sciences. Now, we do provide notification and within 24 hours of becoming aware of a positive case. And the awareness of a positive case is a little imprecise. For the most part, people have notified us when they've been testing positive. And we are getting some notifications, aggregate and without names, from the public health system. We only send out notifications when the positive test is associated with being on campus while symptomatic or during a communicable period. If there is no risk because they haven't been on campus or had no significant involvement, then we don't provide that notification. Next slide. We do share those notifications widely, including physical plant and security, to make sure that everybody is aware and has some alertness to their own protection. We've also added additional cleaning in impacted spaces, even though it may be many days that have passed, and our cleaning processes are equivalent to what is seen in more intense COVID environments. Now, the impact on budgets, of course, these costs are coming at a time of already receiving a $2.2 million cut to our operating grant. We managed that largely pre-COVID by deferring some recruitments, reducing travel, unless essential. We've reduced some professional fees, and we reduced hospitality expenses. So none of the cuts were passed on to either colleges or departments within colleges. It was all managed through these maneuvers. We also did encourage some VPPs, and there was some interest to take advantage of those opportunities. There is a one-time transition fund for universities to apply against, roughly equivalent to the cut that the government had put in place, and tied to additional costs related to COVID or workforce adjustments. But despite having been submitted many weeks ago, there's been no word from government in terms of approval of any of those costs. So it's a bit unclear what the extent of that remuneration or funding will be. Now, we've lost also some revenues. The university shut down in March. We had some significant revenue loss in central animal care, some significant clinical revenues from dental clinics. I've mentioned the 17.5 million fund, and we had also requested funding for a CL3 containment lab in MedMicro. And we are proceeding at this point. The funding was not approved, but we are proceeding at this point with faculty and potentially some other funds participating from the department. And these are just some of the extra costs that we've had to put in place to manage. Certainly, providing PPE has been a significant cost. Because of the dental clinics and the risks associated there, we've enhanced the cleaning within dentistry. We've added entry point screening on the Bannatyne campus. We've moved to ExamSoft as a way of monitoring our virtual exams. We've had to buy dental air purifiers to work at the clinical sites. N95 and half masks and fit testing has been a cost. We've had a large number of Zoom licenses to manage the virtual processes, and they've worked well. We've provided eye protection for students. We've had to purchase additional laptops for people to be able to participate virtually. And we've added a 0.5 of a nurse to OSH so that they could assist us in screening. And of course, the costs of the everyday wear and tear that's caused by COVID is not calculated, but we know is huge, both personally and in terms of activity. Although we've shut down, we do continue to have roughly 1,000 people on Bannatyne campus daily. In October of this year, because of the outbreaks, we did pull students from personal care homes. At the end of October, we transitioned all clinical reasoning and problem-based learning back to remote learning. We had tried to maintain those as in-person learning experiences. We've seen exams being canceled, national exams for both the Medical Council and for pharmacy. We've developed some final clinical exams in medicine for the CCE exam, which is required for their graduation, and trying to provide some options. And we are continuously monitoring and reviewing all of the in-person activity to make sure we're complying with our safety measures. Now, we, in effect, are managing our staff and students in a way that's essentially the same as healthcare workers. And that includes meaning that they're exempt from self-isolating if they have a household member is symptomatic, as long as they isolate from that household member, and of course, show the appropriate precautions while at work around PPE. If you're unable to isolate from a symptomatic family member, either a child or someone that you're involved in the care of, you will need to self-isolate pending a negative COVID-19 test result for the symptomatic household member. So there are limits to the exemption that we have had, and we continue to monitor the impacts on our staff. We've worked with Shared Health to make sure we implement the same PPE requirements as the health system. We moved before the province to make masks mandatory on all indoor sites and have been using medical grade masks and have provided them. We've eye protection and face shields are required when physical distancing hasn't been possible. And we do, as we've said, have entry point screening at level 1 access for BMSB and JBRC. And access is open 24/7 from HSC with swipe cards. And with the addition of the nurse we've done, OESH will screen students when in placement or at UM moving forward, which gives us a much more consistent process. We have tried to find ways of supporting staff and faculty, including the purchase of headphones, sit-stand desks, webcams, printer, ink, office supplies, cables, and that's all been managed at a college, departmental, and unit level. We have had a moving company assist staff with moving equipment to home, such as desks or chairs. And we're pretty clear that we'll be continuing to be working from home for the foreseeable future. Now, of course, we are talking more about the arrival of vaccines, which may begin to come into Canada early in the new year. But frankly, the vaccine numbers will be relatively small, and there will be priority populations not yet defined, probably defined by NACI, which is the national body overseeing immunizations and advising on it. But I would anticipate that we're going to be well into the fall or roughly a year from now before we see any significant infiltration into the entire population with vaccines. We are continuing to work with central administration about other potential reimbursements for home expenses. And we know that frequently there's a question about T2202 forms, which if signed by an employer allow for CRA deductions for costs of working at home. The university has not yet made a decision on that, but I think the advice they've had to date is that this may not qualify. Now, PPE at non-shared health sites, so those areas that are not part of shared health, we've had to provide our own PPE as the health system is understandably sensitive about the supply chain, but we've then had to tap into the supply chain on our own. Student access to rapid testing site, we've had a mixed experience that we're now exploring with shared health, where we've had some students allowed to be screened there, and other students have been turned away. So we're trying to get a consistent approach that says that our students will be treated as if they are shared health staff around that rapid testing capacity. We are organizing N95 mask fit testing, and we've had to hire a private firm. The health system is not prepared to do fit testing any longer. N95 precision mask fit testing, in particular for dentistry students, staff, and faculty, is also in place. We continue to work with Shared Health for communication that around workplace exposures, so we're at least aware of exposures that our students may have had. And we have seen some differential PPP access where nurses on certain wards are wearing N95 masks. And then we discover that nursing students on the same wards working in the same conditions have not been provided N95 masks. So we're trying to work to standardize and ensure the system recognizes our students in an equal way. We still struggle with, as the system is under strain, occasionally students getting sent away from the clinical placements without consultation. And we're working with Shared Health to make sure that those decisions are made at high enough levels that they understand the implications both to service and to the educational program. So those are all efforts that are in progress. N95s, you can't read many newspaper articles without knowing this is a particularly difficult area of supply chain. One of the consequences of an inadequate supply chain is that there have been many suppliers providing small numbers. And of course, every brand of N95s requires specific fit testing. So being fit tested on one brand does not mean you can use another brand without further fit testing. And that's really causes difficulty when our students are moving potentially between hospitals who use different masks. And of course, although we're doing the fit testing, we have a large number of students that require it, and it does take time. And of course, our students are increasingly, because the hospitals are now so full of COVID patients, are increasingly in positions where they have exposures to COVID positive patients. So we are, as we've said before, fit testing all of our students, and dentistry will be using half mask respirators and potentially reusable N95 masks as they become available. We are trying to figure out what to say to students around traveling for holiday break. People need to be reminded that although the policy no longer makes much sense, frankly, that there is a self-isolation rule of 2 weeks for anybody coming from Eastern Canada, east of Traverse Bay. We've worked with the university, who has a central committee, and have, I think in a very positive way, approved all of our requests for in-person teaching over the winter term. We will continue to coordinate PPE centrally so that we don't end up having too many sites ordering for different reasons. And of course, we keep a very close eye on what's happening in the province, and have worked directly with Dr. Rusin and Lynette Saragusa. Now, there have been other things. All Rady students in year 2 or higher have been offered contract tracing positions, or contact tracing positions on a contract, so they are being paid, and we have seen many students and residents signing up for this. And there are other additional volunteer and paid opportunities. Our students are putting on flu clinics through the WISH clinic, and that's been at the request of Shared Health. So we've been trying to help, although once again, it took several weeks to get approval that Shared Health would provide them the PEE to even administer the flu clinic. So it's been an interesting set of discussions, and we have had flu clinics on Bannatyne, the last one being today, by appointment only, and I think there are other plans at Fort Garry. We have seen some in the residency programs, we have seen some resident redeployment occurring in internal medicine, and several departments, of course, have developed redeployment plans. So that's ongoing and can be a difficult set of discussions with PARM, but so far they've been very positive and cooperative. And of course, we are working with PGME on what processes exist for paid leave for healthcare workers when isolated due to exposure in the workplace. And OSH confirmation is required for this, but to date, we think that's working out well. In terms of research, you'll remember that in the spring there was a more significant slowdown, but we once again have slowed research down to 25% of capacity. Human participant research has all reverted to Zoom or Microsoft Teams, and any research in northern and rural communities have been paused unless approved through VPRIO and the community. We have provided PPE at no charge for research personnel on our campus. And HSC has also provided research labs with PPE. We've been requested by the province in anticipation of the Pfizer vaccine. Requires minus 80-degree freezers to see if we had any capacity within Bannatyne to support storage of the vaccine, and many departments have stepped up and have worked to provide some of that support. And there is a fund available through CRSF around COVID expense and stage 3 funds, and we have submitted about $20,000 into that application. ExamSoft has been used in UGME and now used in nursing and pharmacy for delivery online exams with remote proctoring. For the most part, it seems to have been working very well, but required the purchase of quite a few licenses, and Zoom licenses continue to be provided at our cost. For now, although there is a likely increased move to Microsoft Teams, which have no cost to us, but aren't quite as functional around multiple users, certainly as Zoom has been. Office 365 is being implemented in January, and IST has made a change where Teams can be requested now. So if you are interested in moving to Teams earlier, just contact IST. And our Zoom licenses assigned for research do not allow recording. If we do need recording, then we have to reach out once again to IST to access MS Teams. We have seen Security, for safety reasons, discontinuing the Safe Ride, but Safe Walk is still available. And the university has agreed to provide closer parking permits for students or staff that need to attend the site. We have kept lunch and study spaces open for now, but with increasing oversight, as we did see some breakdowns in safety precautions when students in particular were eating together. Food services remain closed, but access to HSC through BMSB doors is available 24/7 with swipe cards. And the distribution of masks has changed. So we continue to watch what's going on, and we're reviewing what, if any, staff, faculty, or students will fall under critical services workers. So we are waiting for that discussion to continue. If you're not feeling well, please follow, the absenteeism and self-isolation process flow sheets that are available. The Faculty of Health Sciences COVID-19 website has all the information you need, and it's that below you. And thanks to everybody, in particular, Raman Dhaliwal has done a remarkable job in managing and working hard to keep us all safe. But really, everybody has stepped up, and we'll need everybody to continue to step up to maintain our collective safety in a changing and increasingly difficult environment. So thank you very much. We're happy to take questions through the chat feature.
Okay, we received some in advance. So the first question was, with the impact of COVID-19 on learning and consistent ever-changing restrictions that have negatively affected students' learning this term, will there be a pass-fail option implemented like there was last term?
Well, I know that's being discussed, but I don't think a decision has been made. And I suspect that will continue to be discussed in the next few weeks.
Okay. Question from the chat. Vaccine priority question. Where in priority will clinical students, residents, and clinical preceptors sit?
Well, we haven't received any information about the priorities. We are hoping and will be trying to ensure that students are listed as health workers, and we assume that health workers will receive some priority. We anticipate the other grouping that will arrive quickly are first responders and, of course, elderly people, in particular, living in personal care homes. But there is another theory that I think is being modeled where maybe the vaccine should be available first to younger populations that are more prone to spread the virus. So I think it remains unclear, but we anticipate that and hope that our students will be categorized with other healthcare workers.
Okay. Another question. I'm wondering what savings, if any, there have been from staff working from home.
I don't know an answer to that. I don't know that we've seen any savings insofar as the salary base hasn't changed. So certainly, if there are savings, nobody's told me about them.
Another question that was sent in advance. What has been done to improve ventilation, central air filtration in buildings on Bannatyne campus?
I don't have an answer to that. Raman, do you know anything through physical plant?
I know that that's being reviewed through physical plant, and we did provide the air purifiers to the College of Dentistry because there's so many aerosol generating procedures. So that's been implemented. But the main thing that everybody needs to be doing is wearing their masks and practicing good hand hygiene and physical distancing. But there is a plan to review regulations.
Somebody mentioned on chat that they've had clerks turned away this week from Area 1 saying they are not employees, but last week the students were received. Confusing.
Well, and that's the point. That's the point that I made, that we're working with the region, that there appears to be a fair bit of inconsistency, and the folks managing Area 1, I think, probably have been told that they have limited capacity in terms of testing. So they felt that students not being employees should be rejected, and we're working with the region to try to ensure that students are included in that capacity.
That's all the questions we have so far. Anyone else? Okay. That looks like that's it then for today.
All right. Thank you all very much. Stay safe.